Hi, I'm Dr. Mashfiqul Siddiqui, or patients call me Dr. Mash for short. I'm an orthopedic and spine surgeon practicing at Farrer Park Hospital. I deal with both general orthopedic conditions like hips, knees, as well as spine problems.
My name is Dr. Ruben Manohara. I'm an orthopedic surgeon with the Shoulder Elbow Orthopedic Group. My areas of subspecialty training are sports injuries, trauma, as well as joint replacements of the shoulder and elbow. Thanks for having us here today.
What are some of the more common sports injuries encountered that you see in your practice?
Well, I do a lot of spine, so I see a lot of back pain or neck pain after sports injuries. Patients come to me after doing some sports and they have these symptoms. Most of the time it's muscular, right? So it's treated easily with some physiotherapy and medication, but sometimes it's something a bit more serious. For example, it can be a tear of the disc or a herniated disc, which is the slip disc. Slip disc can obviously vary from very mild, which is usually treated with physio and medication, to something a lot more severe where it causes compression of the nerves. Sometimes also see injuries like the ACL, which is the anterior cruciate ligament, which is the homogeneous ligament that is torn in the knee. These are usually people who engage in sports that involve a lot of cutting movement, like soccer players, sometimes even those who do contact sports like rugby players. Some of the common injuries that I see.
In my practice of mainly shoulder and elbow pathologies, the three commonest sports injuries I see are shoulder instability and labral injuries, shoulder rotator cuff injuries, as well as tennis elbow. Anyone can get these kind of injuries. It could be competitive athletes, it could be the recreational weekend warriors, and could also be the young as well as the old, because everyone can be predisposed to these kind of injuries.
So you mentioned that it applies to athletes and non-athletes. Do you see that the degree of severity is usually more in athletes than the weekend warrior?
No, that's not true actually. So they're both prone to these injuries for different reasons. A competitive athlete, because of their high intensity training and the competitive nature, is more prone to, let's say, overuse injuries, muscle strain, and therefore these trauma. Whereas a recreational weekend warrior would be more prone to injuries because of their inadequate training or their poor technique. That puts them prone, or giving it all out when that once in a blue moon match that they play. And that's why they're more prone to getting other kinds of injuries. The young might be prone to these sports injuries because, their bodies are still growing and developing, and they may be prone to, say, growth plate injuries. Whereas the older folks are also prone to sports injuries because, their muscles, their ligaments, their joints are not as strong and supple as they were previously, making them also prone to injuries.
I see injuries in both the recreational as well as very hardcore type of athletes, right? As Ruben mentioned about the weekend warriors, it's about conditioning. Most of them are not conditioned. They suddenly have this 90-minute soccer match and they haven't played for the last 5 years, and they suddenly go all out and they go and get an injury, right? So injury-wise, it can be quite similar. An ACL tear is an ACL tear. A slip disc is a slip disc. Especially for the back, I see a lot of weightlifters who try and do things like deadlifts. More commonly, I see patients who do a lot of free weights. I think machine weights usually is a little bit more controlled, but those who do a lot of free weights, especially if they don't have a good spotter or someone to make sure that their posture is correct when they're doing the weights, this one group that tend to get slip disc. And even after treatment, they come back again for the same problem, because they're still not doing it properly.
I know both of you are dads. Have both of you been injured keeping up with the kids over the weekend as well?
I was injured when I was playing badminton after about 10 years. As a weekend warrior, I haven't played for a long time. And then suddenly one of my friends, who's also a doctor, asked me to have a game. And then I was playing with some much elderly folks. So I thought it'd be quite easy, but actually it was not so easy. We're playing doubles, badminton. So obviously, but the two of them can cover the whole court. I thought I could cover the whole court myself, but actually that was a mistake. Next day I had to get a lumbar corset and some coxia.
I think myself, I like to think with age, I'm also getting wiser. So I avoid these dangerous activities. Or I'm well prepared beforehand, and you don't neglect all the stretching and the warm up that goes into it, and the necessary supports and braces or post analgesia that you may require.
Okay, that's an interesting point. How important is this warm up? Do you feel that it can actually prevent a lot of sports injuries if you warm up properly?
Yeah, definitely. I mean, it's always recommended, before you engage in your sport, you should do some basic warm-ups to get the blood flowing through the muscles, get the joints lubricated and moving again, and some dynamic stretches as well to prevent any injuries that may occur during the course of the sport or game.
Yeah, I like to run, and I realized that with age, I have to run slower for a longer distance before I can actually start to push my heart rate up. So as you get older and older, definitely you should spend more time warming up, stretching. If you want to hit a particular target heart rate, you should wait a while first, and that period can be longer and longer. See, if I go for say 7-8 km run, I used to just run 1 km and then I can go faster. But now I realize I have to go slowly for like 2 km, 2.5 km before I feel okay to push. Otherwise, the next day, you feel pretty bad after a run if you start pushing too early. And similarly, post run, you should do a lot of stretching as well. So with age, definitely needs more stretching, more time, more effort before and after the activity that you want.
And then I guess with age, you also kind of have to change your routine a bit, right?
Yes, I have to give myself more time to do the exercise, because actually quite a bit of the time is the pre-exercise, the warm-up and the cool-down, which is very important. Yeah, unlike my kids who just go in and do it and then they come out, and they're okay.
I go to the gym quite often. I would say with age, my routines have changed significantly in just 3 to 4 years. I require more time for recovery in between workouts now. And rather than focusing on carrying heavier and heavier loads, which may put my joints and muscles at risk, I actually work on perhaps maybe lighter loads, but more repetitions or more time under tension. So you get just as good a workout. The volume is there without having dangerously heavy, high loads and intensity on your joints.
What are some early warning signs of a potential sports injury? So, for example, you might not feel a twinge, or you're running and you feel a twinge. When that happens, is it something that you need to be mindful of in terms of, okay, I might have injured myself? Any telltale signs?
I think, following any sporting activity, some aches and pains, especially when you're past 40, can be expected. But let's say we're having persistent pain that is not going away after, 3 days or so, despite rest. Some simple painkillers like Panadol, paracetamol, or anti-inflammatories and icing. Or you find you have a decreasing range of movement or weakness, then I would suggest getting it evaluated by your orthopedic specialist. I mean, this is assuming there wasn't a significant trauma. If there was a significant trauma and there was a potential for a fracture or dislocation, in which case you should seek a medical consult early.
One of the things I always ask the patient is, could you continue the sport after the injury? If they say they had to stop and could not continue, that means usually it's quite significant, And then did they manage to go back a few days later as well? If they can't, then usually it is quite significant, Like, for example, you tear your ACL, right? You cannot continue with the sport after that for sure. Soccer, impossible. You will come out. Then, of course, like Ruben mentioned, pain and all that. Sometimes it's also with swelling. You may have a bit of swelling. For the spine, you sometimes have nerve symptoms. That means you may have tingling, numbness down the leg. Or if it's in the neck, if it's a slip disc in the neck, you get tingling, numbness down the arms. So if you have all those, and if it doesn't get better with the meds, you should go and seek treatment with a professional.
I guess a definitive symptom would be pain.
Okay, there's something called DOMS. Usually about 48 hours after your workout or your activity, you can get some aches and pains. That's actually normal, part of it's physiological, right? So some aches and pains is okay, but as Ruben said, if it doesn't get better with the anti-inflammatories and all that, then you should seek help, because it may not be something as straightforward. It may still be just a muscle strain, which usually resolves. But if it doesn't, and it may be something else, you don't want to miss it. The worst thing is if you have an injury which is significant, you continue to do something and it makes it even worse. For patients, I tell them try and recover first before you go back. Because if you are 50% recovery and you're going back, you can actually potentially worsen the original injury.
So when do you decide if surgery is necessary for a sports injury?
The decision for surgery in a patient with sports injury is individualized based on several factors, including the type of injury, the severity, the chronicity of the injury, the patient's symptoms that bother him, and what his functional limitations are, and what his response to conservative treatment has been so far, and what his individual goals and preferences are.
So there's a time frame you have to go through before you go for surgery?
Yes, because sports injuries are not emergencies. You could always, depending on the severity, you could always try conservative treatment first. And the patient is able to return to his sport at the level that he wants to be at, it can possibly be left alone. Yeah, so it's only those that fail conservative treatment or unable to return to the level of play that they wish to achieve or the original level of play, then they probably would consider surgical intervention.
Some patients after a sports injury may decide, hey, I'm going to change sports. For example, a patient with a ACL tear said, hey, I don't want to play soccer anymore. I'm just going to do maybe straight line jogging kind of thing, on a even surface. At maybe if he's 45 or 50, he may not need any surgery in the first place, because if he's going to change his sports, which doesn't require ACL, for example, and especially if it's other pre-existing things, like for example, already established arthritis in the knee, then he may not need to have any surgery. However, if they want to go back to their original level of activity and the injury has not healed or needs something to be done, then of course sometimes surgery is needed. In the spine, for example, if you have a slip disc, which is big, you've treated conservatively, that means non-operatively, he's gone back and the thing has recurred again and it keeps recurring and he wants to continue with that, and especially if there's some compression of the nerves and he has persistent nerve symptoms or recurrent nerve symptoms every time he goes back to the sports, maybe he may need surgery, right? So usually it's done after a discussion with the patient about what exactly he wants to achieve and what we can do to help the patient achieve what he wants to achieve. Sports injury doesn't mean you must operate and fix it.
So, I mean, we know that, athletes have had their careers derailed. People have to stop football. Like, I think your window is like 35, 36. So I guess certain sports harder on certain areas, right? Like your ACL and so on.
Yeah, one of the sports that have got a very high chance of giving you an injury is things like contact sports. Rugby, I've got nothing against all the contact sports, but it's just that if you're going to do contact sports, there's a chance you can get injuries, right? Rugby, kickboxing, Muay Thai. I've got a lot of patients who are doing all these activities. I have a patient, who had a very bad cervical disc injury, right? After one of these boxing fights. And then I told him, well, we can treat it non-operatively or operatively, but if you keep going back, probably going to injure it at the same level or the level above or below what we operate on, a different level. Eventually, I had to operate on the patient because he's developing worsening symptoms. There's a cord compression in the neck. Now he's gone back, but now he does very bit more sparring and less contact type of sports. Yeah, so contact sports is one of those things that you expect an injury if you don't do it properly, or in just that moment you're not aware you get an injury. So some of these sports are more prone to give you an injury compared to, for example, say swimming, which is good. For the spine, it's very good. I don't know about the shoulders.
Swimming is very good for the
Swimming is very good for shoulders, yeah. So non-contact. So some sports are less likely to give you injuries, some are more likely to give you injuries.
Swimming seems to be like the backup sport, especially when you're injured. It's like, oh, go and swim. It's a sport, but it's also something that it's got like a rehab aspect to it as well.
I mean, generally, yes, swimming is good because, it provides some support to the body and, there's no contact. And I know it's very good for spine.
Yeah.
Spine conditions.
It's very good, yeah.
Perhaps for people with labor problems and overhead movements, it might not be so good for the shoulder. But other than that, swimming is always recommended. Yeah, it's a form of rehab or exercise.
Sometimes even walking in the water, right? Aqua exercises.
Yeah.
So aqua aerobics, those are very, very good. It's not a backup lah. I think backup means it's got this negative connotation that everything else, you're doing it just because, you can't do anything else. But it's not true. It may be your first line. My kids love to swim, both my kids are swimmers. So it's a good sport, good for the core, good for mobility, good for strengthening. So all the pluses for it.
My colleague, he is quite an athlete, okay? So what happened to him was he went to the gym. After the gym, he blacked out, fainted, got sent to hospital. Turns out he has a spinal compression in 3 places. And this was over years of exercise. So it is a sports injury, I would think. But it's like something that is built up over time. That happens as well, right? Even though it's like not immediately, but it does catch up with you. It does build up over time. This is a spine issue. Do you see a lot of people like that, like years and years of running, and then suddenly you don't even know you have spinal compression until it hits you one day?
Yeah, I've got patients like that, like I've got ex-national athletes from other countries. Yeah, I'm not going to mention names, or those who play in the top level, right? Some contact sports like hockey, national hockey, the kind of thing, So they've been hit so many times, right? This contact sports, right? So they have lots of injuries. The disc is non-existent almost, completely flat. They have stenosis, which is compression of the nerves, and but it's been building over a long period of time, and eventually in the late 40s or 50s, they start to have all these symptoms. So probably it's attributed to that. That's one group of patients, right? But then you just treat what is necessary. That doesn't mean that you have to kind of reverse. There's no reversal of the injury in that sense. You just treat what is symptomatic to get the patient back to what the patient wants. So it can build up. One common injury is things like pars fracture, which is basically a fracture of the bone. Usually you see in those with hyperextension, gymnasts, so you see them in these patients. So initially there's a crack, which usually doesn't heal because the blood supply there is quite poor. But many patients are actually okay. They may just have some backache and they're okay. But sometimes over time, it can slip. That means the bone can slip because there's a crack there, which is not really healed. And then that again can cause compression. So that can occur many years after the original injury. So they present with a different problem. They don't really present, they may or may not present with backache, but they'll present with a nerve compression symptom. So that is, again, you can say is the accumulation of the injuries. And then there's another group, those very high level performing, the high performance type of athletes. Usually they'll, when they have an injury, they get things like steroid shots or something to mask the pain so they can continue with the performance during their season, right? So you push through the pain and all that, chances are you're more and, you're likely to worsen the injury, even though symptomatically you can mask it and control it. So that's why we said, if you have an injury, try and get a diagnosis, treat it, make sure it heals before you go back so it doesn't get worse.
Does a shoulder dislocation always require surgery? The short answer is no. For a first-time dislocator, provided there are no other fractures or associated soft tissue injuries other than the labral tear, once the shoulder has been successfully reduced, the patient just needs to rest the shoulder and arm's length for a few weeks and then begin his rehabilitation and physiotherapy. If the patient is lucky enough that he can return to his original level of play in sports without a subsequent episode of instability or dislocation, it can be left alone. However, if the patient would have a subsequent episode again, then the chance of him to have continued recurrent instability is greater than 90%, and surgery would be strongly recommended then.
What are some tips for returning back to the sport after an injury or surgery is done?
Well, following surgery for sports injury, I think to safely return back to your sport, I suggest the following tips. Number one is you want to follow your rehabilitation guidelines and gradually progress through the stages, focusing on, regaining your range of movement and then the strength and then the sport-specific functions that you require. Okay. Number two, you should always focus on technique and form. Work with your coach or your sport-specific trainer to refine the technique that addresses any biomechanical issues you might have that predispose you to getting the injury in the first place. Always start slowly and gradually increase either the duration, the frequency, and intensity of your training sessions. Also listen to your body, and take a break if you're having any pain, and maybe consult your specialist if you're having any persistent, severe pain. One should also always incorporate cross training in their training. So rather than just focusing on their sport alone or just running, they should incorporate other forms of cardio or some weight training as well, so that there's a chance for the body to recover, and you're reducing your risk of overuse injuries and promoting overall fitness and conditioning. Occasionally, you may require the use of protective equipment like knee guards or elbow braces or ankle braces during your sport to prevent any risk of instability or discomfort that you may have. And I'd say maintain a balanced approach with adequate rest and recovery and self-care practices such as proper nutrition and hydration, sleep and stress management.
If you have an ACL tear, you cannot do cutting sports. Sports that require you to pivot and turn, you cannot do it. Because every time you do it, you're going to injure your cartilage, your meniscus, there'll be swelling after that, pain. So you cannot do it. If the brace is so good that it prevents you from, locks your knee and prevents you from turning, you're probably unlikely to be able to do that sport anyway. You know what I mean? Because that sport requires you to turn in a particular way. So if a brace is so restrictive that it protects your knee, you're going to have a lot of hindrance doing that particular activity. The brace may help in the initial acute pain phase, because it kind of restricts the movement and gives you some stability. But if you want to go back to sports that require cutting movement, the brace is unlikely to surface if it was a complete tear of the ACL.
Thanks very much, Dr. Ruben and Dr. Mesh, for joining us today.